Hello and welcome, guys. So for today, we would like to discuss about BCG vaccine, which is Bacillus Calmette Guérin BCG. And as we all know, BCG is for vaccinations against tuberculosis. BCG vaccine can be administered after birth intradermally, and BCG vaccines can cause a false positive mentox test. Although very high-grade reading is usually due to active disease, a systematic review and meta-analysis conducted in 2014 demonstrated that the BCG vaccine reduced infection by 19 to 27% and reduced progression to active TB by 71%. The studies included in this review were limited to those that used interferon gamma release assay. For the efficacy, a number of possible reasons for the variables efficacy of BCG in different countries have been proposed. So none have been proven and some have been disproved. And none can explain the lack of efficacy in both low TB burden countries US and high TB burden countries India. The reason for variables efficacy have been discussed at the length in the World Health Organization WHO documents on BCG genetic variation in BCG strains, genetic variations in population, interference by non-tuberculous mycobacteria, and interference by concurrent parasitic infection. Alright, so usually if we are talking about BCG vaccines and tuberculosis, the main bacteria that involved is mycobacteria. So BCG has protective effect against some non-tuberculosis mycobacteria. And leprosy, BCG has a protective effect against leprosy in the range of 20 to 80%. And for Buruli ulcer, BCG may protect against or delay the onset of Buruli and ulcer. Alright, for cancer patient, BCG has been one of the most successful immunotherapies, and BCG vaccine has been the standards of care for patients with bladder cancer and MIBC, and since 1977. By 2014, there were more than 8 different considered biosimilar agents or strains used for the treatment of non-muscle invasive bladder cancer and MIBC. A number of cancer vaccines use BCG as an additive to provide an initial stimulation of the person's immune system. BCG is used in the treatment of superficial forms of bladder cancer since the late of 1970s, and the evidence has become available that instillations of BCG into the bladder is an effective form of the immunotherapy in this disease. So while the mechanism is unclear, it appears a local immune reaction is mounted against the tumor. So immunotherapy with BCG prevents recurrence in up to 67% of cases of superficial bladder cancer. Also, BCG has been evaluated in a number of studies as a therapy for colorectal cancer. And the US biotech company Vaccinogen is evaluating BCG as an adjuvant to autologous tumor cells used as a cancer vaccine in stage 2 colon cancer. Alright, so in these pages, we will see the microscopic images of the Calmette Guérin Bacillus mycobacterium tuberculosis, which is under the microscope lah. And yeah, this is the micrograph, which is showing granulomatous inflammations of bladder neck tissue due to the Bacillus Calmette Guérin used to treat bladder cancer and HNE stent lah. Alright, for the methods of administration, BCG is given a single intravenous injection at the insertions of the deltoid. So if BCG is accidentally given subcutaneously, then a local abscess may form a BCG oma, that can sometimes ulcerate and may require treatment with antibiotics immediately. So otherwise, without treatment, it could spread the infections, causing severe damage to vital organs. An abscess is not always associated with incorrect administrations, and it is one of the more common complications that can occur with the vaccination. So numerous medical studies on the treatments of these abscesses with antibiotics have been done with varying results, but the consensus is once passed in a aspirated and analyzed. Provided no unusual bacilli are present, so the abscess will generally heal on its own in a matter of weeks. But usually, tuberculin skin test is usually carried out before administering BCG. So a reactive tuberculin skin test is a contraindication to BCG due to the risk of the severe local inflammations and scarring. It does not indicate any immunity. BCG is also contraindicated in certain people who have IL-12 receptor pathway defects, which is interleukin for cancer. So the characteristic race scars that BCG immunization leave is often used as a proof of prior immunization. The scar must be distinguished from that of a smallpox vaccination, which is it may resemble. So when given for bladder cancer, the vaccine is not injected through the skin, but is instilled into the bladder through the urethra using a soft catheter. And for adverse effect, all right. So for adverse effect, BCG immunization generally causes some pain and scarring at the site of the injection, as on how another vaccination or another scar appear when we apply vaccine, when we inject vaccine in our body. So the main adverse effect are keloids, the large raised scars. The insertion to the deltoid muscle is most frequently used because the local complication rate is smallest when the site is used. So nonetheless, the Botox is an alternative site of administration because it provides a better cosmetic outcomes. And BCG vaccine should be given intradermally. If it given subcutaneously, it may induce local infection and it spread to the regional lymph nodes. It will causing either suppurative, or which is productions of pus, and non-suppurative lymphadenitis. Conservative management is usually adequate for non-suppurative lymphadenitis. If suppurations occur, it may need needle aspiration. For non-resolving suppuration, surgical excision and may be required. Evidence for the treatment of this complication is scarce. Uncommonly, breast and gluteal abscesses can occur to the hematogenesis carried by the blood and the lymphadenitis spread. So the regional bone infections, BCG osteomyelitis, or usually we call it osteitis, and disseminated BCG infections are rare complications of BCG vaccination, but potentially life-threatening. So systemic anti-tuberculosis therapy may be helpful in severe complication. Right, for the usage. The age of the person and the frequency with which BCG is given has always varied from country to country. So the WHO currently recommends the childhood BCG for all countries with a high incidence of TB or high leprosy burden. So this is a partial list of historic and current BCG practice around the globe. So a complete atlas of past and present practice has been generated. For the manufacture, BCG is prepared from a strand of the attenuated virulence reduced leaf bovine tuberculosis bacillus. So Mycobacterium bovis that has lost its ability to cause disease in human. So because the living bacilli evolved to make the best use of available nutrients, they become less well adapted to human blood and can no longer induce disease when introduced into a human host. Still, they are similar enough to the Winchester to provide some degree of immunity against human TB. So the BCG vaccine can be anywhere from 0 to 80% effective in preventing TB for a duration of 15 years. However, its protective effect appears to vary according to the geographies and the lab in which the vaccine strain was grown. All right. This is the histories of BCG lah. Histories of BCG, which is it is tied to that smallpox, which is in 1865, Jean Antoine Villemans had demonstrated that rabbits could be infected with TB from humans. So by 1868, he had found that rabbits could be infected with TB from cows, and that rabbits could be infected with TB from other rabbits. So he concluded that TB was transmitted via some and identified microorganisms or virus, as he called it. So 1882, Robert Koch regarded humans and bovine TB as identical. But in 1895, Theobald Smith presented difference between human and bovine TB, which he reported to Koch. By 1901, Koch distinguished Mycobacterium bovis from Mycobacterium tuberculosis, and following the success of vaccinations in preventing smallpox. It is established during the 18th century. Scientists sought to find a corollaries in the TB by drawing a parallel between bovine TB and cowpox. It was hypothesized that infection with bovine TB might protect against infection with human TB. In the late of 19th century, clinical trials using M. bovis were conducted in Italy with distrust result because M. bovis was found to be just as virulent as M. tuberculosis. Albert Calmette, a French physician and bacteriologist, and his assistant and later colleague, Camille Guérin, a veterinarian, were working at the Institut Pasteur de Lille, France, in 1908. Their work included subculturing virulent strains of the tuberculosis Bacillus and testing different culture media. They noted a glycerol spar potato mixture grew Bacilli that seems less virulent, and changed the course of their research to see if repeated subculturings would produce a strain that was attenuated enough to be considered for use as a vaccine. The BCG strain was isolated after subculturings 239 times during 13 years from virulent strains on glycerine potato medium. So the research continued throughout the World War I until 1919, when the now virulent bacilli were unable to cause TB disease in research animal. So Calmette and Guérin transferred to the Paris Pasteur Institute in 1919, and the BCG vaccine was first used in human in 1921. Alright, that's it for today. So that's all for BCG vaccines and the tuberculosis disease. I hope you liked the video. Don't forget to subscribe and like. Thank you for watching.